How many pillows are you sleeping with tonight? 1, 2, 3? Because I need you to know something right now. That number is not about comfort. That number could be one of the most important clues your body is quietly giving you about the health of your heart. And most people, millions of people, have no idea. Half of all adults over the age of 40 in America have some form of hidden, undiagnosed heart disease right now. Half. That is not a scare tactic. That is a documented medical fact. And the terrifying part is, most of them feel completely fine. No chest pain, no dramatic warning signs, just small, easy-to-miss signals that their body has been sending them for years. Today, I am going to show you 7 of those signs. Things you can check on your own body right now. Your eyes, your fingernails, your ankles, your pulse, and yes, your pillows. These are the exact same clues doctors use to catch heart disease before it becomes a crisis. Stay with me. This could be the most important 15 minutes you spend this year. Here is what I want you to understand before we go through these 7 signs together. Heart disease does not announce itself with a trumpet. It does not tap you on the shoulder and say, "Excuse me, I'm building up inside your arteries right now. You might want to get that checked." It grows silently. It progresses slowly. And by the time most people have their first dramatic symptom, the chest pain, the shortness of breath that stops them in their tracks, the heart attack, the disease has often been developing for years, sometimes decades. But here's the hopeful part, and I want you to hold on to this throughout everything we talk about today. Your body is not silent. It has been trying to tell you something. It leaves clues. On your face, in your nails, in the way you breathe at night, in the swelling around your ankles, in the rhythm of your own pulse. You just need to know what to look for. After today, you will. Let's start with the one that surprises people the most. Sign number 1, the pillow question. How many pillows do you need to sleep comfortably at night? Now, I know that sounds like the most random question a video about heart disease could possibly open with, but this single question has helped doctors identify heart failure in patients who had absolutely no idea anything was wrong. Here's why it matters so much. Your heart's job, its one essential job, is to pump blood forward, out of the lungs, through the body, and back again. When the heart is healthy and strong, it does this effortlessly. But when the heart begins to weaken, when it starts to struggle with that pumping job, blood begins to back up. And where does it back up? Into the lungs. Fluid starts to leak from the blood vessels into the lung tissue itself. Doctors call this pulmonary edema, and it creates a sensation of breathlessness, particularly when you lie flat. Here's why lying flat makes it worse. When you are sitting or standing, gravity pulls that fluid toward the lower parts of your lungs. You might feel slightly short of breath, but it is manageable. But the moment you lie completely flat, that fluid redistributes across the entire lung. It spreads, and suddenly breathing feels much harder, like trying to breathe through a wet cloth pressed against your face. So what do people do? They add another pillow, then another. They prop themselves up a little higher without even consciously realizing they are doing it. They think they just prefer sleeping that way, but their body is actually compensating for a heart that is struggling to do its job. So ask yourself this and answer honestly. Could you sleep completely flat tonight, fully horizontal, one pillow, no propping up, and breathe comfortably? Or has it been years since you slept that way? If you need 2, 3, or 4 pillows just to get through the night without waking up breathless, that is not a comfort preference. That is a symptom, and it deserves a conversation with your doctor. Here is a question that catches people off guard all the time, and I mean people who genuinely believe their heart is perfectly healthy. Can you climb one flight of stairs without getting unusually short of breath? Notice I said unusually. Everyone gets slightly winded climbing stairs. That is normal. What I'm asking about is disproportionate breathlessness, where you reach the top of a single flight and you need to stop. Catch your breath, wait for the feeling to pass before you can continue, especially if that is a change from how you used to feel, especially if 6 months ago or a year ago that same staircase felt effortless. Here's why stairs reveal what everyday walking hides. When you walk on flat ground, to the mailbox, around the grocery store, through the parking lot, your heart handles it with a moderate increase in effort. Many people with significant heart disease can walk a mile on flat ground and feel relatively fine. But stairs are different. Climbing stairs dramatically increases the workload on the heart. It demands more from the cardiovascular system in a short burst, and that increased demand is often when the heart's hidden limitations become visible. Think of it this way. A car with a struggling engine might drive perfectly well on a flat road, but the moment you hit a steep hill, the engine starts to sputter. The strain reveals what the flat road hid. Your staircase is that hill. If your engine sputters on the stairs, if you arrive at the top breathless, dizzy, with a racing heart, or with chest tightness that wasn't there before, that is your body telling you something. Do not ignore it. Pause right here for a second. If you are watching this and you are recognizing yourself in these first two signs, the pillows, the stairs, I want you to do one thing before we continue. I want you to think of one person in your life, a spouse, a sibling, a friend, who needs to hear this. Because we're only halfway through the 7 signs, and they get even more surprising. Keep watching and keep that person in mind. Sign number 3, your ankles don't lie. This one you can check right now while you're watching. Look down at your ankles. Do they look puffy or swollen, particularly by the end of the day? Do your socks leave deep indented marks around your ankles when you take them off at night? Do your shoes feel tighter in the afternoon than they did in the morning? If the answer to any of those is yes, here's a simple test. Press your thumb firmly into your ankle or your shin bone and hold it there for about 15 to 20 seconds. Then lift your thumb away. Does a dent remain in the skin? Does the indentation stay there for a few seconds before slowly filling back in? That is called pitting edema, and it means fluid has leaked out of your blood vessels and collected in the tissue of your legs. When the heart is not pumping effectively, blood backs up in the veins. Pressure builds, and that pressure forces fluid out of the blood vessels and into the surrounding tissue. The result is swelling, usually starting at the ankles and feet because gravity pulls it downward. It's the same underlying process as the fluid in the lungs we talked about, just happening lower in the body. Now, swollen ankles do not automatically mean heart disease. Kidney problems, certain medications, long periods of standing or sitting, these can all cause swelling too. But if you're noticing ankle swelling alongside 2 or 3 other signs from this list, that combination should send you to your doctor. Not next month, this week. Sign number 4, feel your own pulse. This is the sign that most surprises people because you can detect it yourself right now with nothing but your fingertips, and what it could reveal is serious enough that I want to spend a little extra time here. Place 2 or 3 fingers on the inside of your wrist, just below the base of your thumb. Press gently until you feel your pulse. Now, don't just count the beats. Pay attention to the rhythm. Is it completely steady and regular, like a clock ticking at perfect, even intervals? Or does it feel irregular, unpredictable, like it skips, rushes, pauses, or seems to have no consistent pattern at all? If your pulse feels irregular, you could be experiencing something called atrial fibrillation, and this is not a minor electrical glitch.
Atrial fibrillation is one of the most significant heart rhythm disorders that exists, and it affects millions of people, many of whom have no idea it is happening because they feel nothing unusual, no pain, no dramatic racing, just a quietly chaotic heartbeat doing serious damage in the background. Here's what happens inside the heart during atrial fibrillation. Your heart has 4 chambers. Normally, they work in perfect coordination, a beautifully timed sequence of contractions that keeps blood moving efficiently through the body. In atrial fibrillation, the upper chambers, the atria, begin firing chaotically. They twitch rather than squeeze. Blood stops flowing smoothly through them and begins to pool, and pooled blood clots. Those clots can then travel through the bloodstream. If one reaches the brain, it causes a stroke. If one blocks blood flow to the intestines, it can cause a life-threatening emergency. Here's the other frightening part. Atrial fibrillation dramatically increases stroke risk. We're talking about up to 5 times the normal risk of stroke. For someone over 60, that's not a statistic to brush past. That's a reason to sit down and feel your own pulse right now. And if it feels irregular, even slightly, call your doctor today, not next week. Today. Many modern smartwatches can also detect irregular rhythms now. If you have one, use that feature, but your fingers can catch it first.
This next sign is one that doctors specifically look for during examinations, and most patients have never heard of it. First, your neck. Sit or stand normally and relax. Now look at the sides of your neck in a mirror if you can. Do you notice a visible pulsing, a rhythmic throbbing in the large vein running along the side of your neck? A small amount of visible pulse can be normal, but if you can see prominent, strong pulsations jumping noticeably with every heartbeat, that can be a sign of elevated pressure in the veins, pressure that builds when the heart is struggling to pump forward effectively. Second, your fingernails. Look at your nails carefully under good light. Do you notice a visible rhythmic pulsation in the nail bed, a faint reddening and fading with every heartbeat? This is called Quincke's sign. It sounds almost impossibly subtle, but it is visible when you know what to look for. It can indicate a condition called aortic regurgitation, where the main valve leaving the heart has become leaky, allowing blood to flow backwards with every beat. Over time, this silent leaking places enormous strain on the heart and can eventually lead to heart failure. Neither of these signs means catastrophe, but both of them mean pay attention. Both of them mean mention this to your doctor at your next appointment. Your neck and your nails are part of your body's reporting system. They are giving you information. The question is whether you are listening.